Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Jaundice and its types. So starting with the type of jaundice, that is pre-hepatic. So what is the serum bilirubin, serum urobilinogen and the urine bilirubin? These are the main components. So first component we are going to see is serum bilirubin. Next is the urine urobilinogen. And last component will be the urine bilirubin. Now let's break it down. So under the pre-hepatic, the serum bilirubin will be increased. So indirect will be increased and the urobilinogen will be increased. This is in serum, this is pre-hepatic. And now we move on to the hepatic. So let's write it down. So this is pre-hepatic. Next we move on to the hepatic. So under hepatic there is increase, and this increase in the direct as well as the indirect will be increased. The urobilinogen will be normal as well as it can be decreased, and the urine bilirubin it can increase or decrease. Lastly, looking at the post-hepatic. So under the post-hepatic, the serum bilirubin, it will be increase in the direct. So post-hepatic will have increase in direct, pre-hepatic will be increase in indirect of the serum bilirubin. So in terms of the urine bilirubin, urobilinogen, it will be, there won't be any significant change, and looking at urine bilirubin, it is positive. To learn and grow daily like this, please do subscribe.